Hi, everybody. Thank you for joining us today. Today, we will be talking with Dr. Slater. She is a physical therapist here in Dallas, and she's going to tell us a little bit about her job and what it means to be a physical therapist. So let's let her get started.
Hi, everybody. I'm Dr. Kat. I am a physical therapist in an outpatient orthopedic clinic. So, what physical therapists do, we're pretty much movement specialists. So, we help those that are recovering from injuries, surgeries, that are currently in pain and unable to do their normal activities of daily living or play sports. We help them to get back to all of those activities and to function better without pain. Yeah, it's a very exciting career.
So why did you choose this job?
I actually knew in high school I was recovering from my first big injury of an ankle sprain, and I worked with a physical therapist, and he was so special and he loved his job. And I thought at the time I was a sophomore in high school, and I thought this is what I want to do. I want to be active. I want to work with athletes. I want to be just moving around all day. And so, yeah, I knew from being a sophomore in high school, I did a pre-physical therapy track in college. That's how much I knew I wanted to be a physical therapist. And I graduated on a Saturday and started physical therapy school on a Monday. That's how much I knew that I wanted to be. Just, yeah.
Well, that's awesome. Can you tell us about your favorite thing about your typical day?
My favorite thing about my day is the variety of patients that I see. So, in the setting that I'm in right now, I see all various types of injuries or surgeries. So it's constantly changing, and it's exciting. And I treat all different ages as well. So I'll have a 12-year-old basketball player come in, and then the next hour I'm treating a 65-year-old retiree. So it's constantly different, and it's exciting, and it's active, and it's just fun to meet different people and hear their stories and help them to get back to normal life.
That sounds like a lot of fun. How many different types of jobs are there in your field?
That's something else that drew me to physical therapy is the flexibility and the different settings that you can work in. So right now I'm in outpatient clinic, which is just like a standalone clinic part of a company, but you can work in the hospital, you can work in the ICU, you can work with athletes, you can work in skilled nursing. There's all different types of settings, and that's what really drew me to it. Is if I want to work with kids, I can go to pediatrics. If I want to work with athletes, I can go on that career path and work with sports teams. And also just the hours are a little bit flexible. So I knew I wanted to become a mom one day. So I knew that if I ever wanted to excel and become, I have been the director of a clinic, and I knew if I wanted to go along that and be more of a director of a regional director, I could try that. Or if I wanted to step back and be part-time to focus on my family, that physical therapy has that flexibility.
Nice. And so you told us a little bit about what you do in your job. Does it take any special talents or skills to be able to do your job?
So to become a doctor of physical therapy, it did require 4 years of undergrad and then a 3-year doctor of physical therapy program. That's kind of your typical pathway to become a DPT, a doctor of physical therapy. But what's exciting is you can work in the physical therapy setting as different. There's different avenues. There is a PTA, which is a physical therapy assistant, and that requires a little bit less schooling, and you get to do practically everything that a doctor of physical therapy is able to do. We work as a team. We always work as a team. So we have techs, which in my company we call them operations service specialists, but you have everybody working as a team, and they help people with their exercises. So yeah, there's different avenues to become a physical therapist assistant, physical therapy aide, tech. A lot of different avenues if you're interested in working in this setting.
Very cool. How do you see this job changing over the next 10 years? Do you see it expanding? Are there going to be a lot of job openings? Is it growing?
It continues to grow. It continues to grow, especially as we have a population of individuals becoming older. There's constantly job offers. Like I get job offers weekly for different settings. So there's a constant need for physical therapists. And that always excited me when I was shadowing physical therapists. They were like, I always get job offers. So even during COVID, we are essential healthcare workers. So there was the job stability during COVID. But yeah, it will continue to expand, and yeah, it will continue to expand. And then they're pushing for direct access, where individuals can go and see a physical therapist first. So that's an exciting avenue that they're pushing for physical therapy profession. So it will continue to grow, and there's great job stability with that.
So for these students, when you say going to see a physical therapist first, can you explain why that wouldn't, what the difference of how it is now versus what you're talking about it becoming possibly?
Yeah, of course. So right now, to see a physical therapist in a majority, and in Texas for sure, you have to go to your doctor or your orthopedic surgeon and get a referral. And what they're pushing for is for you to be able to go to a physical therapist to get screened first, to kind of skip a couple steps. If it is your normal shoulder pain, if it is your normal knee pain, we are the movement specialists. So we should be kind of that profession that you can come to and be assessed, possibly without the need of imaging. But of course, that's the new thing with physical therapy becoming a doctorate of physical therapy, is you take new courses that are for, they call it differential diagnosis. So being able to screen patients so that we can refer out when it is beyond our scope of practice.
All right. And for this job, is it everywhere in the United States? Can you move around and change places?
You can, yeah. So actually, you can drive down the street, and just on the street that I work on, there's 5 other physical therapy clinics within like a 3-mile radius. So there's good job security. Yeah, it's all over. There's even you can be a traveling physical therapist if you're interested in going around the country. You can spend 12 weeks in California, and then you can the next 12 weeks you can go to New York based on need. So that was something I was very interested in, that because that allows you to kind of see different settings and travel the US. And they give stipends for living. So it's a really cool, you are away from family, but if that interests you in traveling around the United States, it's a really cool, yeah, it's a really cool avenue.
For our middle schoolers, stipend is basically you're getting money. You're getting money to survive. So not to worry.
Yeah, sorry.
Oh no, it's you learn all these new words as you go into a job, and it's they talk about in medical school as well. They're like you start talking in a different language almost. And so, and just for the last kind of general question about your job, your social life and activities and hobbies, do you feel like you're able to do everything that you want to do outside of work?
I am. And that's what is great about physical therapy, is that flexibility. If I wanted to take on extra hours, if I wanted to go work Saturdays to make more money and work in a hospital part-time, I could do that. If I want to scale back, there is a lot of flexibility with that. So I'm able to, I have a daughter and a husband and a dog that I love. So I feel like I'm able to spend great quality time with them. There's a very good work-life balance about being a physical therapist. Mm-hmm.
And so going a little more in depth on kind of the education and training you talked about, you told us there are a couple different routes of different jobs you can go into to do that. What courses should students try to do well in, or really, pay attention in if they're thinking about this type of job?
Your sciences, for sure. Those are going to be important. And I kick myself because my high school offered an anatomy course and I didn't take it. And that would have been a blast. Like learning the body. What is so cool is you are your own cheat sheet with anatomy. Like if I'm taking a test on the hand, I can look down at my hand and move it around and be able to answer questions based on that. So I think it's fascinating to know more about how we move. And so, yeah, if you get offered a class on anatomy, take it, and your sciences. Yeah. Try to just focus on your sciences. Those are the best.
Well, I'm sure there's science teachers who are helping promote this course will love that answer. As your job is changing, the world is changing, new technology every day. How do you keep up And how does your job help you keep up with new knowledge and skills?
So as a physical therapist, we are required every couple of years to maintain continuing education. And being part of my company, they offer, that's a really cool thing about companies is they'll offer courses or online training, especially right now with COVID. I have access to tons of videos and courses on different body parts, on different injuries. So I continue to learn. It's if you ever feel like you know everything, you're stagnant. You need to keep learning, which is also exciting and keeps you on your feet and keeps you up to date on everything. But yeah, so that's every couple of years. But I always go way beyond the 30 hours because that's exciting to learn more, to know more. There's so much knowledge at our fingertips. So it's continuing to change, but you just keep up with it and continue to take courses, which is what I do.
And I'm sure most students want to know, do those courses have tests at the end?
Oh gosh. The ones that I take have like 2 questions. So easy peasy. No, yeah, testing is yeah.
Thing of the past, hopefully. That's
Yes. Oh my gosh, yes.
all right. So in your typical work week, how many days a week and about how many hours a day do you work? And I know you said that there's some different options you can choose, but what have you chosen for yourself?
So currently I work part-time. I work 20 hours and I'm blessed to work Monday through Thursday in the morning shift. So I have a consistent schedule, which is great for a family. I don't work Fridays, which is really cool as well. Every weekend's a long weekend. That's great. Before I stepped down, I was the director of my clinic and the hours were a little bit more varied, but I still had a couple days where I would only work 5 hours. So I never had to take off time for appointments or I'm still able to get exercises in for myself. So yeah, right now I'm part-time, but if I want to, that's the great thing about the flexibility of being a physical therapist or physical therapist assistant is I can go back up to 30 hours to 40 hours. It depends on setting as well. So right now in outpatient orthopedic, which is if you drive down the street and you see a physical therapy clinic, that's likely what it is. We just treat all different types of patients that are able to come into the clinic, not hospital. But it depends on setting. So we kind of have to be more varied with our hours just to, because if the clinic's open 7 to 7, you have to work with your team members to fill those times. But other settings offer more maybe an 8 to 3, 8 to 5 kind of. So that's just a question to ask when you do. If you're interested in being a physical therapist, you can ask those questions, and it's exciting to learn from different physical therapists what they've chosen for their schedule.
And do you use a lot of different tools in your job? If so, what are they? Do you have to buy them yourself? Are they provided?
So the tools that I use in the clinic are provided by my company, and that's something super exciting about physical therapy is I love the hands-on aspect of it. The exercise, giving exercises specific to each patient is also exciting because you get to say, like, this week I have a tennis player that I'm treating, and we incorporate tennis moves, and I have a ton of tennis balls to work on coordination and, just making therapy fun for her. So it's a blast. Hopefully I'll make her a physical therapist one day. But yeah, so I use, there's so many different techniques that fall under kind of, they call it the scope of practice. It's kind of what I'm able to do as a physical therapist. One that I love is called dry needling, and we get to use needles that are like acupuncture needles, but we get to use them in the muscles to help them kind of stretch out and get more motion. So I get to use needles, and we use tools to help kind of with soft tissue. So like massage and cupping. There's all different types of fun tools and techniques that we can do.
So what is cupping?
Ooh, cupping. So, I wish I had the setup here. So cupping is, it's a cup that goes on the skin, and we use suction to pull the skin up, and it helps to kind of bring blood flow, to relax the muscles, to help with movement. So yeah, I also get to use those different techniques with patients to kind of try and see what can help them the best. So that's another aspect of the job. Like I never know if I show up that day, it helped the patient before we do it, or I can kind of switch up my technique, and it's fun. It's fun for me to do different manual techniques like that.
Sounds awesome.
Mhm.
The needling, I'm not sure how good I would be at that. That might freak me out a little bit. But concerning kind of the finances around your job, what is the kind of typical salary of somebody kind of coming into this job?
Yeah, so the median physical therapy salary for a doctor of physical therapy is about in the 80s. I think it's a little bit less than that for somebody coming right out of school. For a physical therapist assistant, I want to say it's more in the 40s or 50s, but that's still for a little bit less schooling, and you're able to do a majority of the things that physical therapists are able to do. That's a really exciting, and it can go up from there depending on setting. So if I wanted to work more in home health, which is where you go and treat patients at their houses, that could be for the older population, or you can even work with kids at their house too, which is really cool. You can make a little bit more. So it depends on the setting that you work in, but about like 80 and up is about, but there's so many things included in that with companies, is all these courses that I'm taking are offered through my company for free. So that saves me a lot and gives me an avenue to learn more and more about my profession all the time.
Very nice. Yeah, all the things included, that's a good point of like those could cost extra, but companies a lot of times, and they really care. They're invested in you and they want the best physical therapists to work with them, and so they're going to give you all the things that you need to make sure that you stay on top of it, and that also gives you room to grow and move up and do different things as well.
Yeah.
So for the pandemic, a lot of things have changed with different people's jobs. How has the pandemic affected the field of physical therapy?
Because we are essential, physical therapy clinics did remain open, which is exciting. They did start to offer, and companies started to cover visits online. So that is something neat that's come out of the pandemic, out of COVID, is they're allowing more flexibility with being able to treat patients just like this from home while they're in the safety of their home. Um, but yeah, so they did. Companies did have to uh, maybe give people a little bit of time away from the clinic, but everybody's coming back because we knew that it would just be a little temporary, and then patients need to come in for pain and for injury. So um, it's an essential job, and I feel like I'm busier now than I was before COVID hit, because people do just, they need to be treated and need to be seen, and want to get back to normal life. So that, yeah.
All right. Well, for a student who might be considering this as part of their future, or maybe they really like sports and this has piqued their interest, what advice do you have for them going forward?
Go spend time with physical therapists. Go shadow all the different settings. I loved, even if it's just 15 hours, spaced out over some weeks. I loved to go in to different clinics and see how different physical therapists work. If it's in the hospital, if it's in a clinic out just on the street, it's so cool to see different, to see different settings. And I still, to this day, I still remember patient experiences, how patients and physical therapists um, interacted back then years ago, and I still use that today in my treatment. So that's what's cool, is that you're getting your foot wet, you're getting your toes wet, and kind of like, do I like this setting? Do I like this setting versus the hospital versus home health, which is what I mentioned, treating patients at home, and you get to spend time and see them work with athletes, and you get to kind of narrow down to what setting you want to be in. But yeah, go spend time. And so many, I love it. I love it when students come into the clinic and they say, can I come and shadow you? I love it. I'm like, yes, please come and spend 5 hours. Patients will mention their kids or their grandkids and how they want to come in. And I'm always wanting people to come in and watch what I do, because it's exciting and I love it. And I try to make all of my little athletes, I try to make them all become physical therapists. That's my dream.
Well, I'm sure some of them will become it because you seem very excited about your career and everything you're doing, and it sounds very exciting. So I want to say, thank you for coming to share with us today. To the students, remember that you need to complete your 2-minute survey for health professions. It's the same survey for all the health professions, lessons, and different interviews. It takes only 2 minutes. And remember, once you've completed 80%, you will receive your certificate. So thank you for joining us today, and we'll see you next time.